Hello class, this is Andrea Romano. This is my head to toe assessment. I will start by scanning the room and then I will proceed with the assessment. There's the computer. This is just my supplies, Ishihara, stroke scale. There are no notes. I have provided for privacy for my patient and myself. Okay, I'm going to wash my hands and then start the assessment. Hi, my name is Andrea Romano. I'm a nurse practitioner student. I'll be doing a head to toe assessment on you today. Is that okay?
Yes.
Okay, so your vitals are, your temperature is 98.6, your heart rate is 72, your respiration rate is 20, your blood pressure is 120/80. You're 5'7" and 170 pounds, which gives you a BMI of 26.6.
Okay.
Okay. What's your name?
Tony.
And what time of day is it?
At night.
It's night. Okay. And who's the president?
Joe Biden.
All right. And can you tell me the difference between an apple and an orange?
Apple's a red fruit and orange is an orange colored fruit.
Okay, and how are oranges the same? How about apples and oranges are the same?
They're both fruit and they're both round.
Okay, and if you wanted to get to Florida by tonight, how would you get there?
On a plane.
On a plane. Okay, so patient is alert and oriented ×3, and judgment and abstract thought are intact. I'm going to give you a 3 words. Apple, table, chair. I'm going to ask you periodically through the assessment to tell me those words, okay? So try to remember those. Also, can you count back from 100 by sevens?
100, 93, 86, 79, 72, 65, 58, 51, 40.
Okay, that's good.
4.
That's perfect. All right, and then I'm going to test for stereognosis and graphesthesia. So can you close your eyes? Can you tell me what this is that I just placed in your hand?
Paperclip.
Okay. And you tell me what I'm writing in your hand.
An 8.
An 8. Okay. So stereognosis and graphesthesia are intact. Okay. And what were those 3 words that I asked you before?
Apple, table, chair.
Good. All right, I'm going to begin the assessment of the head, eyes, ears, nose, and throat. I'm just going to grab some supplies. Okay, looking at the face. The skin is intact. I don't see any evidence of pallor, jaundice, or cyanosis. I don't see any ecchymosis or lesions. I don't see any suspicious nevi. The eyes are symmetrical. The outer canthus of the eyes line up to the top of the ear. The nasolabial folds are symmetrical. The corners of the mouth are symmetrical as well. Looking at the hair, it is evenly distributed. It's clean. I don't see any areas of alopecia. I'm going to palpate. I don't feel any lumps or bumps. Do you feel any pain when I do this?
No.
No. And the scalp is white and firm. I don't see any lesions, and so normal skin assessment for the scalp. Going to assess for cranial nerve number 7. Can you puff your cheeks? Can you smile? Frown? Stick your tongue out? And close your eyes. So you can back to normal. Cranial nerve number 7 is intact. I'm going to start with the examination of the eyes. Let me just grab them. Okay, I'm going to assess cranial nerve number 2. Can you hold this 14 inches from your face and read that line.
937826.
Okay, vision is 20/20. And then can you just tell me what numbers you see?
8, 5, 12, 29.
Okay, cranial nerve number 2 is also intact. Patient has passed the Ishihara color blindness test. Okay, so we're looking at the eyes. The eyelashes are everted. I don't see any ptosis. The sclera is white. The conjunctiva is pink. And I don't see any arcus on the cornea. I am going to elicit the red reflex. So just going to be shining this light in your eye. Okay, and I can see the orange glow of the red reflex. Corneal light reflex, I'm just going to shine this light in the middle in between your eyes. And I can see that it's a symmetrical response. I can see the light shining back. It's in the middle of the pupils and it's in the same area for both eyes. I'll do the fundoscopic examination. Okay, so I can see the macula, which is going to be on the temporal side. The optic disc is going to be on the nasal aspect. I can see in all 4 quadrants the ratio to arteries and veins is 2 to 3. The arteries are a lighter color red, and the veins are brighter color red. I don't see any hemorrhages, any nicking or cotton wool. So normal fundoscopic examination. Again, we would do this on the other side, but for the sake of saving time, just going to do a lot of these tests unilaterally. Okay, so I'm going to test for extraocular movements. So just follow my finger, okay? Okay, and can you cover one eye? And just tell me how many fingers in one go.
2, 2, 2, 1.
Okay. Confrontation is normal. Can you just follow my finger? Okay. And I can see the pupils, they converge and constrict as my finger moves closer. Can you look off into the distance? And now look at my finger. And again, I can see the pupils converge and constrict. So this is, for convergence and accommodation, is normal. Going to do the pupil, test for the pupils reflex. So right now the pupils are about f4. I'm going to shine the light. And it goes to a 2. And then I'm going to see if there's a consensual response, so I'm only going to shine in one light. And I can see that this pupil goes from a 4 to a 2, so it was a positive consensual response. Okay, we're going to move to the ears. I don't see any swelling. The skin is intact. It is cool. It's pink. I don't see any exudate. Is there any pain when I do any of this?
No.
No. Patient's not reporting any pain, so I will continue with the examination of the ear. Okay, I can see that the ear canal is patent. I can see the cilia. I don't see any cerumen. When I look in the eardrum is flat. It's got a gray pearly color. Cone of light is at 5 o'clock, and I can see the arm of the malleus. I don't see any erythema. I don't see any excessive cerumen in the ear. So again, it's a normal finding within the ear. Going to conduct the Rennie and the Weber test. So we'll do the Weber first. Can you tell me raise your hands and tell me which ears you can hear this in? Okay, so test is negative for lateralization. Okay, tell me when you stop hearing the noise.
Yeah.
Okay, so bone conduction, air conduction is lower than bone conduction, so again, this is another normal finding for the Rinne test. We will go on to the examination of the nose. The nose is midline. The nose does kind of curve off to the right side. I don't see any suspicious nevi, no ecchymosis, no lesions, no swelling of the outer nose, and then I'm going to just look inside the nose. Okay, I can see the cilia is present, the mucosa is pink, I don't see any turbinate swelling or any discharge, so normal findings within the nose. I'm going to test cranial nerve number 1. Can you close your eyes and tell me what you smell?
Cloves.
Cloves, okay, he's correct. Cranial nerve number 1 is intact. Okay, can you close your eyes again? Going to assess cranial nerve number 5, the sensory.
That's my forehead. Right side. One left cheek. My right chin.
Okay. Cranial nerve number 5, the sensory component is intact. Can you clench your jaw? Okay. And then the cranial nerve number 5, the motor aspect, I feel a symmetrical contraction of the muscle is intact as well. Can you open your mouth again and close? Okay, and the temporal mandibular joint, did you feel any pain when I was doing that?
No.
No. So patients denying pain, I deny feeling any crepitus. I'm gonna feel the temporal pulses. Does it hurt when I do this?
No.
Okay, and the temporal pulses are 2+, and patient denies any pain, and I don't feel any cording either. Okay, I'm gonna put my gloves on to inspect the mouth. Okay, so looking at the mouth is symmetrical, the lips are pink, they're moist. Can you show me your teeth? Went up really big. Okay. Under the tongue. Okay, can you say ah?
Ah.
Alright. And I could elicit the gag reflex, which is cranial nerve number 2, but I'm just going to state it for the purpose of the examination. Okay, so I can see the Wharton's ducts, I can see the sublingual salivary glands. They are patent, I don't see any swelling or erythema. The posterior pharynx is pink, I don't see any exudate. The tonsils are a 2+, I don't see any tonsil stones or exudate as well. The teeth are intact, he has no missing teeth. I don't see any evidence of dental caries, and so now I'm just going to palpate the inside of the mouth. And stick out your tongue. And the tongue is midline. There is a slight white coating, and I can see the papillation. You can put your tongue back in. Can you actually stick your tongue back out? Lift it up, down, left, right. Stick your tongue back in. Press against my hand. Press against my hand. Okay, cranial nerve number 12 is intact as well. We're going to move on to the examination of the posterior chest. So if you could just turn facing this way. Okay, I'm just going to untie your gown. Okay, So, and you know, while I'm here, can you just swallow? And then swallow again. Okay, and the thyroid gland, I can feel it move up and down as the patient swallows, but I don't feel any nodules or swelling. So, looking at the back, I see that the musculature is appropriate. Do you feel any pain?
No.
Okay, and in here in your paravertebral muscles?
No.
No, and the cervical spine, no pain?
No.
Any pain here when I press?
No.
No? Okay, and I'm going to test the costovertebral angle. Tell me if you feel any pain.
No. No.
No, so no pain. Skin is warm, dry. Okay, and we'll go with the assessment of the lungs. I'm going to listen for your lung sounds. Okay, and just breathe in and out as I move the stethoscope. Okay, so I want to note that I hear the bronchovesicular sounds, and as I go down more vesicular sounds, and the right middle lobe in this general area. I'm going to assess for egophony and bronchophony. If you could just say the letter E.
E. E. E. E. E. E. E. E. E. E.
Okay, and I can hear a muffled E in all areas of the lungs, which would indicate that there's no evidence of consolidation. Again, we'll do bronchophony. Can you say 99?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
And I can hear muffled 99, which indicates to me that there is no consolidation. If I heard it louder in any of the fields, I would suspect there would be consolidation. And again, in all areas of the lungs, I heard no rales, no rhonchi, no wheezing in any of the areas. So bilaterally, lungs are clear. Going to percuss. And it's just for general residents. Okay, and then I'm going to percuss for diaphragmatic excursion. So if you could take a deep breath in and hold it. Okay, and I can hear the sound change around here. You can let the air out. And if you could exhale and hold it. Go ahead. Okay, and I have a diaphragmatic excursion of about 4.5 centimeters. Again, I would do this on the other side to make sure that my findings were symmetrical, but for the video I'm only going to do it once. We're going to assess for chest expansion. Go ahead, one more time. Okay, and I can see the symmetrical separation of my hands as the patient inhales and exhales. So normal chest excursion. And again, looking in the back, breathing looks effortless, easy, and no evidence of respiratory distress. You can come face forward. Okay, and I'm just going to pull this down. And again, looking at the chest, the skin is intact. I don't see any retractions. I don't see any lesions. I don't see suspicious nevi. I don't see the patient using any accessory muscles. Breathing is effortless and smooth. So I will listen to the lung sounds. Okay, lungs are clear bilaterally. I don't hear any rales, rhonchi, or wheezing, and I'm hearing bronchial sounds were a bit louder in nature, which again is a normal finding. We'll go ahead and do tactile fremitus again. Say 99.
99, 99, 99, 99, 99.
Okay, and I can feel, as I did on the back, that I can feel the vibrations in the upper lobes, and then they diminish as I go down to the lower lobes of the lungs. And then I want to note that the AP diameter is 1 to 2, so no evidence of barrel chest. I will begin the cardiac assessment. Okay, and I'm going to start by feeling in all 5 areas. So the aortic is going to be second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point is third intercostal space, left sternal border. Tricuspid is third intercostal space, fourth intercostal space, left sternal border, and the mitral area, or PMI, is going to be the fifth intercostal space, mid-clavicular line, usually under the nipple. And then if you can't feel it, you can have the patient lean forward and off to the side, and I can feel a gentle tapping on my finger from the PMI. I'm going to listen in all areas as well. And I can breathe.
Okay.
And I can hear a clear S1, S2. There's no evidence of S3 or S4. There is no gallops, no evidence of murmurs, no thrills, anything. And then feeling on the chest, I don't feel any thrills or gallops or heaves. Okay, I'm going to listen more intently for a heart murmur in the aortic and mitral areas. So just lean forward. Okay, and then lean over to the left. Okay, and I don't hear any evidence of murmurs. Again, it's a clear S1, S2, no thrills, gallops, or clicks. I'm going to feel for the carotid arteries now. Carotid pulses are 2+ bilaterally. I'm going to listen for bruits. And I don't hear any bruits bilaterally in the carotid area, so it's a normal cardiac assessment. Okay, can you lay down? I'm going to do jugular vein pressure, and then I will go to the abdominal assessment. So can you just lift your head up a little bit? Okay, there you go. And just sit up for a second. So patients sitting, I don't see any jugular vein distension. Jugular veins are flat, and then we'll lay the patient down at an approximately 30-degree angle. I can see the slight pulsation. Okay, and I'm going to hold this at the angle of Louis, and this where I see the pulsation. So I do this at approximately 3 centimeters. So I add 4, so a jugular vein pressure of approximately 7. Okay, you can sit up. Okay, and lay back flat. So looking at the abdomen, I don't see any exaggerated vasculature. I don't see any lumps or bumps, no evidence of ascites. So I'm going to listen for vowel sounds, and then I'll also be listening for the arterial sounds in the abdomen as well.
Chew.
Bless you.
Thank you.
Okay, vowel sounds are normal, active. I can hear vowels. I can hear the clicks and gurgles in all four quadrants. I'm going to listen for the aorta and the renal arteries. Okay, and I can do this with the bell and the diaphragm of my stethoscope. I don't hear any bruits in the aortic and or the renal arteries. So again, that's a normal finding. I'm gonna percuss the abdomen, and we'll hear a few different sounds. We'll hear a little bit of timpani, like a hollow sound, and then some dullness when we're over organs or stool. Okay, I'm going to palpate percuss over the spleen, and I can hear the dullness as I'm on the left costal border, the gastric bubble, so it is a resonant sound. And then when I percuss over the bladder, I get a flat sound. I'm going to feel for the inguinal lymph nodes. Also, you can feel for the inguinal pulse as well when you're in here. I don't feel any lymph node swelling in the inguinal area. I'm going to assess for splenomegaly. Okay, and I can't feel, so negative for splenomegaly. We'll do rebound tenderness after I palpate in all four quadrants. So just tell me if you feel any pain.
No.
And then with deep palpation.
No.
No pain?
No.
Okay, so I'm going to assess for rebound tenderness. So can you just tell me whether you feel pain when I push in or when I pull out? No pain?
No. I mean, it feels like you're pushing on my stomach, but
no pain, no.
No pain.
Okay, so negative for rebound tenderness. I'm going to assess for the psoas sign. Can you lift your leg? Do you feel any pain?
No.
No, so negative psoas. Okay, I'm just going to lift. Can you bend your knee? And I'm going to... Any pain?
No.
Okay, so negative obturator. Negative obturator sign. Okay, so I'm going to feel for the liver. Good job, side. Okay, using the rolling technique. You take a deep breath in and out. In again. And out. Okay, so no evidence of splenomegaly or hepatomegaly. I can feel the liver just on the tips of my finger when the patient exhales. So again, no evidence of splenomegaly or hepatomegaly. All right, you can sit up. Oh, you know what? Sorry, I didn't do liver span. So I'm going to percuss for liver span. Okay, so I hear it change over here. Do you hear it change? Right here.
Mm-hmm.
a liver span of 6 centimeters, which is normal. Anywhere between 6 and 12 centimeters would be considered normal for liver span. Okay, so you can sit up. And again, what were those 3 words that I asked you earlier?
Apple, table, chair.
Good. Okay, so we're going to go to the peripheral and musculoskeletal assessment now. Okay, so can I see your hands? Okay, so I don't see any swelling of the joints. Capillary refill is less than 2 seconds. The approximate angle of the nails is 160 degrees, so no evidence of clubbing. Can you spread your fingers? Can you close them? Can we do thumb opposition? Good job. And then can you squeeze my fingers? Squeeze, squeeze, squeeze. Okay, +5 strength bilaterally. The remainder of this test I will be doing unilaterally, but of course you would be doing this bilaterally. So, and you flex, extend, good range of motion, and then push up, no, just with the wrist, and down. Okay, 5+ strength in the wrist. Okay, so we're going to do the forearm, the elbow. I don't feel any crepitus in the joint. I don't see any swelling. Again, the skin is intact. Hair distribution is normal. Okay, can you flex, extend? Okay, and then push up. Just bend at the elbow. Okay, and then good. So +5 strength in the forearm. I move up to the shoulder. Okay, shoulder joint feels normal. There's no pain when I press on it.
No.
Right? Skin is intact. Multiple freckles, but no suspicious nevi. Alright, so we're going to flex, extend, hyperextend, abduct, adduct. Okay, and then push against my hand. Push against my hand. Push against my hand. Push against my hand. Okay, so +5 strength. Range of motion is intact. We are going to assess for sharp and soft sensation of the upper extremities. Can you close your eyes? Can you tell me what you feel and where?
Sharp on my right arm. Soft on my left arm. Sharp on my right hand.
Okay. And then we're going to take our tuning fork and again assess for sensory in the upper extremities. Can you tell me what you feel?
My wrist.
Yeah. What do you feel?
That's like vibrating. That's on my wrist, yeah, vibrating.
Just say vibrating.
Vibrating. Vibrating.
Okay, and again we would check this bilaterally. Going to assess for deep tendon reflexes. Okay. So we're going to strike the tendon right here for the radial. And I can see the contraction of the arm. So again, 2+ and brisk. We'll do the brachial. And I can see the contraction of the bicep when I do that. Tricep. And I can see the contraction of the tricep, and it's 2+ and brisk. Moving on to the lower extremities, we'll do the deep tendon reflexes. So the patellar, okay, 2+ and brisk. Can you hold your hands like this? Okay, we're going to do the Achilles, 2+ and brisk. And we're going to assess for the Babinski, negative Babinski sign. And then can you pull your foot in towards any pain?
No.
You can release your hands. Okay, so negative Homan sign as well. Okay, let's lay back again. Could do range of motion of the lower extremities. Okay, I don't see any edema, pitting or brawny. Capillary refill in the feet are less than 2 seconds. So I'm going to bring your leg up, and I need you to kind of move it around, and we're just going to assess the peripheral vascular. Alright, so when I have your leg put down, we're going to slide this way, okay? So sit up, scoot forward, and then hang your foot down. And I can see that the color returns to the foot in less than 10 seconds. Okay, and we're going to assess for carpal tunnel. So can you push your hands together like this? Do you feel any pain, numbness, or tingling?
No.
Okay, so it's a negative Fallon's test. Okay, so another assessment for carpal tunnel. Tell me if any of this hurts.
No.
Nope. Okay, we're going to assess the the peripheral vascular of the hand. So close your hand. Okay, so I'm going to release on the radial side. You open your hand. And I can see that the hand quickly flushes pink back to normal. So again, I'm going to occlude the radial and ulnar artery. Close your hand again. Open. I'm going to release the ulnar. And again, the hand flushes back to pink very quickly. Okay. Going to assess, you can lay down again. Alright, so can you close your eyes? Tell me what direction I have your toe pointing.
Pointing up. Down. Up. Down.
Okay, good. So great, it's good like positional awareness of the, alright, and then tell me whether you feel sharp or soft.
Sharp. Soft. Soft on my foot. Sharp on my left foot.
Okay, and then tell me what you feel when I do this.
Vibration. 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 Vibration.
And again, you would do this bilaterally, but for the sake of this exam, I'm only going to be doing it unilaterally. So, can you bring your toes in, out, spread your toes, close them up. Can you bring your soles of your feet together? No, like twist your foot. No, hold on. Twist your foot like that.
Oh.
And then out. There we go. Good. And then press. Pull. Good job. So range of motion is intact in the feet with a 5+ strength. Okay. Can you raise your leg up? Okay. Down. Up again. Out. In. Okay. And then up. Down. Out. And in. Out. Good job. And 5+ strength. Again, I don't see any swelling in any of the joints. I don't feel any crepitus. Okay, so again, lift your leg up, down, out, in, and then again, up, down, out, in. Okay, good. So range of motion in the lower extremities is intact with 5+ strength in all of the major joint areas. You can come and sit up again, face forward. Okay, I'm just going to test for pulses. Okay, radial pulses are 2+ bilaterally. Brachials are 2+ bilaterally. Popliteal is 2 plus pedal pulses, 2 plus. Dorsalis pedis is a 2 plus as well. Okay. Alright, so we're going to stand up. I'm going to assess your gait, and I'm going to do the Romberg test. Okay, so can you close your eyes? And the patient is not swaying at all. So this is a negative Romberg test. Can we do our range of motion of our waist? So can we lean over this way? Lean over. Twist. Twist. Okay. And then I want to assess your gait. So if you could come by me and just walk regular that way. Okay. I can see that the gait is steady. The arms swing in opposition. Can you turn around and walk back to me on your tippy toes? Again, gait is steady. Balance is good. Walk back on your heels. Gait is again steady. And then walk heel to toe. Good job. So tandem walking is good as well. Let me just get you all buttoned up. Okay, scoliosis. Can you just lean forward? All right. And I don't see any evidence of scoliosis. You can stand up. There's no evidence of lordosis or kyphosis. So that concludes our assessment. Thank you and have a good night.